Good afternoon, everyone. Chris Lyon from Lewis, Longman and Walker here in Tallahassee. Lewis, Longman and Walker serves as the general counsel and legislative counsel to the Florida Association of Special Districts, and has for many years. And we thought that with everything going on with the COVID-19 pandemic, it might be helpful and useful to special districts to hold a quick webinar to go through some of the things that have occurred and how they impact special districts, how they impact your operations. So that's what we've done. We actually did a similar webinar about, what's it been, a little over a week ago, and the response was so great that we ended up having to cap the meeting attendance because so many people at the last minute tried to get in. So we decided that because of that, we would do a second meeting for those that weren't able to get in the first time. So, first off, I want to wish everybody good health. I hope everyone is safe and healthy. I initially want to talk about who is going to be on today's call and who will be presenting. In the first part of the presentation, Terry Lewis from our West Palm Beach office and Nicole Pope from our St. Pete office will be talking about some sunshine issues that have arisen, and specifically relating to public meetings and some relief that has been provided there. Seth Bain from our West Palm Beach office will follow that with some discussion about public records and how we should be dealing with public records requests during this time. After that, Natalie Cato from our Tallahassee office will provide a brief update on some elections changes that have occurred due to the COVID-19 pandemic and how those might impact special district elections and or special district elected officials. And then finally, Glenn Thomas and Jim Lynn from our Tallahassee office will be talking about employment and retirement issues that have come about during this pandemic and some of the relief that has been provided there. I know everyone has been watching CNN or Fox News or your news network of choice, and so we've all seen the national and international numbers, but I did kind of want to bring it down to Florida for those that, haven't really kept up with how Florida's doing here. And there's a great website that the Department of Health has developed, and you can find it by simply Googling Florida COVID-19 dashboard. And this gives you the most up-to-date information in the state. It's updated twice daily, I believe, at 11:30 a.m. and 6:30 p.m. And as of the 11:30 a.m. update this morning, we have, in total cases in Florida, stand at 28,832. Total hospitalizations in the state, 4,509. Deaths in the state of Florida due to COVID-19, 960. It shouldn't surprise you that the most populous counties in the state lead the way with the most cases. Dade County has over 10,000 cases, followed by Broward, which has over 4,000 cases, followed by Palm Beach County, which has over 2,000 cases. That really shouldn't be surprising. I guess on a little bit of good news, a positive note, it does appear from the tracking that new cases are declining. Looking at the data that on the Department of Health's website, it looks like we hit our peak in new cases per day back on April 3rd with about 1,300 new cases that day. And it's been trending downwards ever since. And as of yesterday, there were 743 new cases, so about half what we saw back on April 3rd. So just looking, and it's not a perfect line graph down. It bounces back and forth by the day, but, the trend is moving downwards, which I think is probably why this week the governor, actually at the end of last week, he announced that he was convening a task force to discuss and make recommendations on how to reopen Florida's economy. And he has the task force has been broken up into individual industry segments, and they have been meeting by teleconference all week, sometimes twice daily this week, and coming up with guidelines and recommendations on how to reopen Florida's economy once the governor feels like we're ready to do that. So, that's a little bit of good news, that maybe a little light at the end of the tunnel, that we're looking at ways to gradually open Florida's economy. So with that brings it back to a Florida level. At this point, I think I'd like to turn it over to Nicole and Terry to talk about some of the open meeting issues that have arisen during this crisis and what the state has done to alleviate that somewhat. Nicole and Terry.
Well, good afternoon, everybody. Terry and I, like Chris said, are going to speak to you about Sunshine Law issues and COVID-19, including Executive Order 20-69, virtual meeting tips and considerations, and also provide some information on essential services, including Executive Order 89 and 91. So to start, I'm going to talk about Executive Order 20-69, and on March 20th, 2020, the governor issued this executive order. And what it does is that it suspends any Florida statute that requires a physical quorum be present and that requires a specific location for a public meeting. It also grants local government bodies the ability to use virtual technology to conduct meetings as provided in Section 120.54, which is a provision in the Florida statutes which provides a little bit of guidance on how to conduct virtual meetings and what needs to be required in the notice provisions, but typically this provision is used in the agency context, but the executive order applies it to all local government bodies. So it's important to note what Executive Order 20-69 does not do, and it does not suspend any of the regular tenements of Florida Sunshine Law requirements. So the basic principle that meetings need to be open to the public, reasonable notice needs to be provided, and minutes need to be taken are still in effect. And so then the question becomes, if you're going to have a virtual public meeting, how are you going to do so in order to continue to meet the requirements of the Sunshine Law? And I would say that the first step in the analysis should be looking into, does your meeting actually have to take place? Or is there a legal requirement that you host the public meeting? Is it critical that you have the public meeting? And as time goes on, this is becoming, easier to answer, and yes, you need to move forward with your meeting. So with that, the next thing I guess to look at would be, is there a way to limit the scope of the agenda such that you're not dealing with super contentious issues in a virtual setting, just based on the nature of the complications that come with having a virtual meeting. But if you decide, yes, you need to move forward with a virtual meeting, there are some things that need to be taken into account in the context of keeping your meetings open to the public and providing reasonable notice. And in the context of keeping meetings open to the public, some things to consider having, and what has worked for other jurisdictions and other local governments who have already had virtual public meetings include a live stream, a mechanism in place, maybe having telephone coverage occurring by staff members so that the public can continue to participate. A question needs to be asked of, are you going to have the public able to call in? Do you want them to present questions before the meeting? What platform are you going to use, and how are you going to make your meeting accessible to people that might not have a computer or who have disabilities? So how are you going to incorporate closed captioning potentially? So these are all things to consider with respect to keeping the meetings open to the public. The other important factor is reasonable notice, and we have provided to FASD templates for a notice for a special virtual meeting that basically sets forth, how people can public comment if that's going to be included, how they can participate and attend the meeting, language including ADA requirements, because those requirements haven't been lifted by the executive order, so those considerations still need to be taken into account, and basic time, location provisions. And with that, and one of the questions that we've had associated with notice is, does the notice need to be published pursuant to Chapter 189? And yes, it still does need to be published. The only caveat to that is that in the case of a bona fide emergency meeting, you can have an emergency meeting to deal with the emergency without providing a published notice. Reasonable notice still needs to be provided, but it doesn't have to be published, and then it can subsequently be ratified. But for the most part, as best practice, the notice should still be published. And with that, another tip, consideration, something that's proved helpful in other cases, is actually having a script to help your board members hit all of the things that they need to hit during the meeting. It's a kind of a wonky setting in a virtual capacity. They might not be in the room with their fellow board members. So having a script to make sure, the meeting runs as smoothly as possible in a virtual setting is important, and also a checklist. So, roll call taken, if something's being voted on, all of the votes are in, and at the end of the meeting, that your record is preserved, and you can take minutes. Some folks have been using, all sorts of different technological avenues, Facebook Live, things like that. And, one big consideration is at the end of that, well, how are you going to preserve that record as required by the Florida statutes? So with that, I'm going to turn the presentation over to Terry, and he is going to talk to you about essential services and Executive Order 89 and 91. Thank you all.
Okay, thanks, Nicole, and welcome everybody. My purpose is to cover essentially what amounts to designated essential services, which get more or less exempt from the restricted activities list that certain of the executive orders cover. This is a little bit of a history lesson. And on March 1, because of the COVID outbreak in Florida, Governor DeSantis issued two executive orders, 51 and 52, declaring the state of emergency for the state of Florida. And between that time and March 30, which is a next date to pay attention to, it was discovered that 60% or more of the COVID positive tests, were discovered in the southernmost populated counties, Palm Beach, Broward, and Miami-Dade. That had been earlier recognized in Miami-Dade County particularly, in that the county itself, which is empowered to issue executive orders, issued an executive order 7-20 that identified essential services and also adopted Center for Disease Control's social distancing guidelines and recommendations. That occurred, I guess, March 19th. By March 30, Governor DeSantis issued Executive Order 20-89. That also, adopts a list of essential services, including all of those that were identified in the Miami-Dade County, executive order. Executive Order 2089 also has the social distancing requirements in it, or guidelines issued by the Center for Disease Control. Just running through a quick list of essential services and activities for those of you that may be interested and wonder if you or your clients are included, it goes like this: healthcare, activities of all kinds, any kind of provider or service related to healthcare. The restrictions in these orders are waived for that. Grocery stores, anything to do with food, agriculture, the news media, gas stations, auto repair, any kind of mailing and shipping, colleges, universities, schools, that kind of thing, provided that the training is remote. There's things such as laundromats, dry cleaners, restaurants, it's pickup and delivery only. Office products, food shippers that ship to residential locations, transportation services of all kinds, home-based care, for children or adults, ALS and nursing homes, professional services, that includes legal, engineering, accounting, those kinds of things. Laundromats, I think I said that, landscape and pool services, pet stores, logistics, and quite a number. I mean, things like public utilities, infrastructure, are all included in the waste management, construction sites that are open and ongoing. Fortunately, liquor stores get a waiver. The firearms do too, veterinarians, and mortuaries. That's, again, the list. There's more to it than that. If you pull what I'm about to say, Executive Order 20-91, it expands the application of essential services and social distancing from the 4 southernmost counties, including Monroe, to the state. It has the provisions in it entitled Safe at Home, for senior citizens and those with compromised immunity systems, where it's recommended that you don't go out if you can possibly avoid it, and if you do go out, only go out for required needs, food, that kind of thing. Like I said, Executive Order 2091 does adopt the Miami-Dade County Essential Services list, and then also adds more services identified by the Department of Homeland Security's, guidance. That if you want to delve deeply into this, you can pull Executive Order 2091, and it has the Department of Homeland Security list on it, which is very voluminous. Executive Order 91, also identifies essential activities that are exempted from the restrictions. One of those is religious services. Others include certain kinds of recreational activities such as walking, running, swimming, biking, those kinds of activities, but with the understanding that you're going to observe social distancing, while you're carrying out those activities. Oddly enough, pet care, gets a waiver, and then if you're having the care in-house, for a loved one or friend, that's regarded as an essential activity. What are the non-essential services to one extent or another? Big athletic events, bars that sell only, liquor, bars, not liquor stores. Sit-down restaurants, again, with a limitation that the restaurant can provide pickup and home delivery, they can do that. Gymnasiums, attractions, big ones such as Disneyland, Disney World, Universal, musical concerts, movies, and in certain beach going in certain places. That's one of those where it appears to be opening back up. Same thing with the golf. It depends on the local desire, one way or the other. Here in Palm Beach County, golf is regarded as non-essential. In Martin County, golf can be played provided you're, a Martin County resident. Their golf courses are open for residents. And then social gatherings of greater than 10 people are recommended against. Those are regarded as non-essential. Executive Order 91 does expire, on April 30. It can be renewed, over and over again for 30 days if the governor wants to do that, which he has indicated he probably would to some degree. And Chris mentioned this, but where do we go from here? Governor DeSantis has appointed his committee to reopen Florida, and it's on a fast track to report to him either tomorrow or Saturday with a series of recommendations from listening to him, listening to others, that are relatively influential. It appears as though some loosening is in the cards, probably beginning, May the 1st. I mentioned beach going with social distancing. That's a likely candidate. Another likely candidate for becoming, an essential service or being taken off the non-essential service list would be elective surgery, within hospitals. I didn't realize it until this started, but apparently the big moneymaker for hospitals that keeps them alive economically is elective surgery. So those would be two, probably the noisiest group wanting some, lessening of their restrictions. Are the restaurants, hotels, those folks. I would not be surprised if they don't get some kind of relief in the near future. It won't be entirely, but that is essentially where we are. What I would advise as a final comment is that today, tomorrow, Saturday, pay attention to the news if you can whenever Governor DeSantis comes on. He is appearing daily at this point, and you probably get the latest information on what he thinks the state is going to do or what he wants it to do and is within his power within the next few days. And with that, Chris, did you say Natalie goes next?
No, I think I'm up next, Terry.
Oh, okay, Seth then. Go ahead, Seth. Sorry.
No problem. Thank you, Terry. This is Seth Bain. I'm in the West Palm office of Lewis, Longman & Walker. As Chris mentioned, I'm going to talk to you today a little bit about public records. Why we want to highlight this specifically is because while there's been a lot of focus on public meetings, how to handle those, and how the governor's orders have modified those rules and provide some other options, the governor's orders have not addressed public records and so have not modified the obligations that exist in the statute specifically for public records. So we wanted to provide a little guidance on that, just some things to think about and perhaps some best practices as we get through this unusual period. Just as a brief reminder, I'm going to read the definition of what public records are. All of you that work in special district governments are, I'm sure, familiar with these to some extent. But the takeaway is that it's a very broad definition, which is all materials made or received by an agency in connection with the transaction of official business, which are used to perpetuate, communicate, or formalize knowledge. And as you are probably aware, because we often talk to our districts about this, is that's not just the official work products that come out of the district. It's not just your letters and your resolutions and those sorts of things. It certainly includes emails when those emails are dealing directly with district business and are transmitting information in and amongst your staff. But even more importantly now, as many of us have been working to work remotely, ask our staff to work remotely, is that there's an increasing use of some of the even less formal communications, be it text messages on your phone, be it chat functions such as you can utilize through this video conference tool that we have here today, et cetera. These things are also are subject to the public records laws when they are in fact dealing with district business. So as your staff are working perhaps from home or in unusual situations, we would want you and your records custodian to be thinking about that, to be reminding them that if they are receiving emails or text messages, they should not be deleting those unnecessarily, and that when there comes a time when everyone's moving back into their offices and we're able to begin a more normal process, that you think about whether there needs to be an opportunity to transfer files from someone's phone, from their computers. And another important caveat is if somebody's working on their home computer, that does nothing to affect whether or not that's a district record that's subject to public records retention and access by the public. So that's the sort of first reminder we want to put out there as we have employees working in sort of different and perhaps unique or unusual situations. So that's that part. The second part, of course, is what happens when we get a public records request. Many of our districts, and perhaps at this point virtually all of them, have gone to some form of limited public interaction to the extent possible. They're limiting staff's access. So in some cases, even staff's access to the district offices is being limited, much less the public. And so with that, what happens when there's a public records request? Very often, many of our districts, most of their records are kept, and certainly the historic ones are in paper format, in boxes, in files, on shelves. So when we look at the statutory requirement that still stands, is the first important point is when someone makes that request, the statute reads that one must be permitted to inspect at any reasonable time, under reasonable conditions, and under supervision by the custodian of public records. So that right away, when we lawyers see a word like reasonable, we immediately are happy because we know it's something that we can argue about later. But more importantly, it's something that in an instance like this, we can say, hey, there's a bit of a shield here when we look at this to recognize that we're in an unusual circumstance, that what is reasonable right now, one would imagine as this plays out in the future, be viewed a little more understandingly that what a reasonable time frame and a reasonable time frame to respond and provide is a little bit different. But there's also, looking at the statute, there's a requirement that a government agency must acknowledge requests to inspect or copy records promptly and respond to such requests in good faith. And so that's the important second takeaway that we want to make today. Whoever your custodian is, hopefully they have or can still receive either the email from the email address that should be listed on your district website, or receive calls from the district phone or messages, so that when those public records requests come in, you can do step one, which is acknowledge that you've received the request. Let them know that you understand it, you've got it. If there's a clarification as to what it is they're looking for, you can certainly engage in that communication. But then two, say, there's something at play here, and here will be your individual situation, is the response. Those are physical records that are stored in our district. We're currently limiting access to that space, and thus we will get those to you as soon as we can. Is that response, we have those items, you have a right to review them. However, right now we only have one staff person in. We can begin scanning those and send them to you, because a partial response is always permissible under a public records request, or is a response for what they're asking is perhaps electronic files that you can in fact get access to and provide to them. So it's certainly going to be on your individual situation, but what we would encourage you to do is make sure you still have a process in place to acknowledge receipt of that public records request and to in fact make that good faith effort. When people have gotten in trouble in less unusual times, with the courts. The term that they'll cite is an unjustified delay. Did a district or government engage in some form of unjustified delay? Now, I would like to think going forward, if you've shown that good faith effort, if you've shown the acknowledgement, and if you do in fact, make every effort possible under your particular circumstances, that you're not going to get in trouble down the road for an unjustified delay. So that's our guidance on this today. So those are the two takeaways. Make sure you're continuing to think about, if you're working with staff in a dispersed manner, that those staff are cognizant of what they're using to communicate, and that those communications remain public records and need to be retained. And to make sure that you're responding or acknowledging responses to public records requests as promptly as possible, but then recognizing that you will not get into trouble if you are making the good faith effort in response to your particular conditions. And obviously, if you have any questions about it, you can reach out to us. So that's what I've got. I think I will now be turning it over to Glenn Thomas and Jim Lynn. Thank you.
Actually, Seth, we are going to have Natalie up next talking about election law.
Sorry, my mistake. Thank you.
Hi, everybody. I'm just making sure. Oh, I'm a little higher than I thought I was going to be here. Sorry. There we go. Hi, everybody. I'm Natalie Cato. I'm in LW's Tallahassee office, and I am part of our legislative council team, as well as many of you may remember me from such events as the annual conference and the annual election law update. A couple things on elections. I think I do want to address just sort of overall where we're at in Florida with elections. There is no reason to think that we will not have elections as scheduled in August and in November in Florida. Florida has a very robust vote-by-mail program, as you are all probably aware. In Florida, you can vote via an absentee ballot with, you don't need any excuse. You can simply turn in a standing absentee ballot request. And so as we saw even in March with the presidential preference primary and the municipals, we were able to continue our elections as scheduled, even under the threat of the virus. So I do not anticipate at this point that we're going to see any change or disruption in the way we run our elections. There has been a question about qualifying and qualifying dates. At this point in time, the qualifying dates and the qualifying standards are still the same. So you're going to want to check with your local supervisors. They set the qualifying dates for those particular counties. If you're in a multi-county special district, those are at the state level. And I can, if anybody has questions about specific dates, I can certainly send you those. There are a couple changes, emergency rules that are in effect for qualifying. And these are important for you all if you are in a situation where you are actually acting as the qualifying officer for your district. Also, if you are running. And also, I think it's important for you all to know these things, even if you all are not serving as the qualifying officer, if the supervisor is as serving as the qualifying officer, in case you get any questions for your district. Because one of the keys about qualifying is you want to make sure that the information that you are giving to candidates is always consistent. So because of the pandemic, the Department of State has issued 2 emergency rules about qualifying, and both of these relate to being able to send the paperwork in electronically. If you are serving as the qualifying officer for your district, if you all have not delegated that duty to the supervisor of elections, the very first thing you should do right now is make sure that you designate an email address to receive the qualifying paperwork. For reasons that I'm going to get into in a second. So if you haven't done that, that is the absolute first thing you should do. Secondly, they have updated the rule related to candidate petitions. So for any candidate that is qualifying via petition, rather than paying the qualifying fee, the candidate does not have to submit original signatures on the petitions in order for those petitions to be counted. And so the effect of that means that if you are gathering petitions to qualify, you can have your supporters email you those petitions, and then those will count. It is unclear in the rule whether you can then email all of your petitions to the supervisor or to the qualifying officer for verification, or whether you have to physically drop off the petitions. However, given that the overall spirit of this rule is that things can be done via email and electronic format, it would stand to reason, and for most supervisors I have spoken to, they are interpreting this to be that all candidate petitions can be emailed. They do not have to have physical copies of the copies of the petition. Similarly, when it comes to the actual qualifying paperwork for a candidate, and so this is the qualifying fee and the DE6 form and those things. If you are an elected official, you have seen these forms before. You no longer have to actually provide the physical copy with your original signature on it in pen and ink. You can now do an electronic version and then send that to the qualifying officer. The one thing to know about this is that you do have to mail your check. So the best practice here, other than checking with your supervisor to make sure that they don't have something special that they're doing, is to make sure that your check is mailed so that it arrives on the first day of qualifying, but you can still have until the last day of the qualifying period, just typically 5 days, to submit your qualifying paperwork to the email address that has been designated by the qualifying officer as the place to receive the qualifying paperwork. That is really all the elections update that I have for now. So I am now going to turn it over to Jim and Glenn.
Thanks, Natalie. Okay, I'm going to talk about two sections of the Families First Coronavirus Response Act, and that would be the emergency paid sick leave and the emergency family medical leave expansion. Both of these are in effect between April 1st and December 31st of this year. Starting with the Emergency Paid Sick Leave Act, who's entitled and how much do they get? Under this act, an employee is eligible for up to 2 weeks, a maximum of 80 hours of paid sick leave if he or she can't work because of one of 6 qualifying reasons related to coronavirus. The reason the employee can't work will determine whether they're entitled to full pay or 2/3 pay. If an employee can't work because they are subject to a federal, state, or local quarantine or isolation order, or they've been advised by a healthcare provider to self-quarantine due to concerns related to coronavirus, or they're experiencing symptoms of coronavirus and are seeking a diagnosis, that employee they're entitled to either their regular rate of pay or whatever the applicable minimum wage is, whichever is greater. And the maximum amount they can get is $511 per day or $5,110 over the entire 2-week paid sick leave period. If the employee can't work because they're caring for somebody who's subject to a quarantine or isolation order, or someone who has been advised by a healthcare provider to self-quarantine because of coronavirus, or if they are caring for a child whose school or their place of care was closed and child care is unavailable, or if they're experiencing any other similar condition that may arise as specified by the Secretary of Health and Human Services, those employees are entitled to compensation at 2/3 their regular rate of pay or the applicable minimum wage, whichever is greater. And the maximum under those 3 circumstances is $200 per day or $2,000 over the entire 2-week period. The reason the employee can't work, it has to be because of one of those 6 reasons. If they're not working for any other reason, they're not going to be eligible for paid sick leave. For example, if there's no work to do at the job and an employee has been furloughed, and that employee starts showing symptoms of coronavirus. So they satisfy one of those 6 reasons. They're still not eligible for paid sick leave because the reason they're not working is because they've been furloughed and there's no work to do, not because of their symptoms. So, you know, even if somebody does satisfy one or more of the reasons, they're still not eligible because that's not the reason they're not working. I would note if somebody has not been furloughed and there's work to do and they are working and they provide notice that they satisfy one of these 6 qualifying reasons, that would not be the good time to tell them they're furloughed. That's going to raise possibilities of a violation, and violations of this act are going to be covered under FLSA as a failure to pay minimum wages. So who's a covered employee? All employees are covered. It doesn't matter how long they've been there, how many hours a week they work. All employees are covered and eligible. Covered employers, if you're on this webinar, then you're probably covered because it covers all public agencies. Now, how many hours is an employee entitled to? Well, if they work full-time, they're entitled to the maximum 80 hours. If they work part-time, their number of hours is going to depend on how many hours they work over a 2-week period. If their schedule varies from week to week, you should look to the last 6 months prior to the request for leave to determine the average number of hours this individual works over a 2-week period. Now, if somebody's a full-time employee and they usually work overtime, that overtime has to be considered as well in the number of hours worked. It doesn't have to be considered as far as the rate of pay. You don't have to pay time and a half, but if an individual usually works 45 or 50 hours a week, then you have to pay them for the 50 hours a week. Now, keep in mind that doesn't change the maximum, so if you paid somebody 50 hours the first week, then you can only pay them 30 hours the second week. The emergency family and medical leave expansion creates a new category of paid leave for FMLA for employees who can't work because of the need to care for a son or daughter under 18 because the child's school or place of care has been closed and a child care provider is unavailable because of COVID-19. These are 10 weeks of paid leave. The first 2 weeks are unpaid, and an employee can either have unpaid leave or unpaid 2 weeks of leave, or they can use the emergency paid sick leave for those 2 weeks, or they can use their accrued sick or vacation leave, whichever works. After the first 2 weeks, leave has to be paid to the employee at 2/3 their regular rate of pay, times the number of hours the employee would normally work. The maximum is $200 per day or $10,000 in total for the entire 10-week period. Expanded FMLA is not in addition to unpaid leave. Employees are still only entitled to 12 weeks per year. The only difference is that these 10 weeks are paid. So if an employee has already used FMLA leave for some other reason during the FMLA year, and I'll explain that in a second, the amount of Emergency Family Medical Leave Act leave would be reduced by whatever amount they've already taken. So if they've already used 12 weeks of FMLA leave, then they're not entitled to take any Emergency Family Medical Leave. Covered employee is any employee that's been there for 30 days. And covered employer, again, all public agencies are covered by this. So what is an FMLA year? This is something that would be an employer policy. You would choose what your FMLA year is, and it probably is in existence. You probably already have one, and it just defines the 12-month period as either the calendar year. It can be any fixed 12-month period, for instance, your fiscal year. It could be a 12-month period measured from the date an employee takes FMLA leave. So if they took some in 2019, it could be 12 months from that date, or it can be a rolling 12-month period that's measured backwards from the date they use FMLA leave. So this would be something that's already a policy and should be, your policy should be looked at to determine if somebody has leave left. I do want to just finally just make sure it's understood that the expanded leave under FMLA, it only applies if the reason the employee is not working is that they're caring for children whose school or their place of care is closed because of coronavirus. The place of care could mean not only a school, it can mean daycare. It could also mean, for instance, camps. You know, if your schools are closed during the summer, the reason can't be because schools are closed because of coronavirus, because they're not closed from coronavirus, they're closed because it's summer. But if you normally put your child in a camp during summer and those camps are closed, then that counts as a place of care. So any daycare facilities, preschools, before and after school care programs, summer camps, summer enrichment programs, those are all included in the place of care. And there also is an emergency responder exclusion under both of these, under both the expanded family medical leave and under the emergency paid sick leave. Under these, you are allowed, a public employer is allowed to exclude emergency responders from both of those. It isn't automatic. It's something you have to choose to do. It not only covers, an emergency responder is not only a police officer or a firefighter or an EMT, it also covers things like public works personnel, people with skills or training in operating specialized equipment or other skills needed to provide aid in an emergency, as well as individuals who work for the facilities employing those individuals. So it's a little broader than what you would consider an emergency responder to be. An employee who is asking for paid leave needs to provide documentation. There has to be some evidence that what they're asking for is factual. An oral written statement by the employee that they're unable to work, emailed in, is probably satisfactory, but doctor's notes and similar kind of documentation would be useful. Employees are entitled to be restored to their same position after they return from paid sick leave and or expanded family medical leave. And that's about all I have, and I'm going to turn it over to Jim Lynn for an overview of the CARES Act and Executive Order 20-88.
All right, thanks, Glenn. I am going to spend the last few minutes here talking about the Coronavirus Aid, Relief, and Economic Security Act, and specifically the provisions of that law that impact public retirement plans. And that is I know there's been several federal enactments. This is the one that passed on March 27th. This was the $2 trillion CARES Act is what it's been referred to as. And so in addition to providing a good deal of money to businesses and hospitals and state and large local governments, this act contains several specific things that relate to retirement plans. The first thing is it allows tax-free or tax-favored withdrawals from defined contribution plans. These would include 401A type plans, 457 plans, and 403B plans. Again, defined contribution plans, these are the kind of plans that in which employees have an account, and they typically invest their accounts, and their benefit is based on whatever is in their account. So what this law provides, the law now, before this act passed, allowed for hardship withdrawals from these plans, and Congress has expanded on that to allow coronavirus-related withdrawals of up to $100,000 from an employee's retirement account. These withdrawals would not be subject to the 10% early distribution penalty that is typically imposed before normal retirement age, taxes would be due on the withdrawals, but they can be repaid over a 3-year period. And so if an employee, for example, takes a coronavirus-related withdrawal and then increases his contributions in the future so that it's repaid within a 3-year period, there would be no tax on that distribution either. The coronavirus related distribution would apply to anyone who is, or would be available to anyone who is diagnosed with COVID-19, whose spouse or dependent is diagnosed with the virus, or anyone who experiences adverse financial consequences as a result of being quarantined or laid off or having their work hours reduced, or their kids being out of school or daycare and the individual having to take off work or possibly leave employment as a result of that. This is not intended to be an intensive fact gathering exercise for employers. The administrator of the retirement plan is allowed to rely on the employee's certification that he or she meets those criteria. So that's one aspect of the CARES Act, the withdrawals from defined contribution plans. There's also a provision that allows for loans of up to $50,000 from a 457 plan or a 403B plan that allows loans. And under there's other criteria that apply, but basically the loan, it's not $50,000, it's up to $100,000, but it's reduced by any amount of outstanding loan that the employee already has. And again, the criteria is the same. The qualified individual is one who is either diagnosed himself with the COVID-19 or whose spouse or dependent is diagnosed or who has experienced adverse financial consequences as a result of the quarantine or the other emergency circumstances. And again, here there's a provision that says that the 5-year repayment period on the loan can be delayed so that the 5-year repayment period for any outstanding loans could be delayed for at least 1 year. These provisions on the withdrawals and loans are not mandatory, and so employers can provide them in their plans, but they're not required to. Something that is required, though, is the waiver of the required minimum distribution rules. These are the rules that require retirees to take money from their defined contribution accounts. Again, these would be 401A accounts, 457 plans, 403B plans, and up until just recently, when the Secure Act was passed at the end of December, employees had to begin taking distributions from their accounts at age 70 and a half. That's been extended now to age 72. And under this temporary waiver in the CARES Act, it is provided that no distribution at all has to be made in this calendar year, in 2020, notwithstanding any of the other rules. The other thing I wanted to briefly mention is the Governor's Executive Order 20-88 concerning the reemployment of FRS retirees. And basically, this order, which was issued on March 30th, allows FRS employers to temporarily re-employ retirees, FRS retirees, in mission-critical positions. And these would be law enforcement officers, first responders, emergency management, health and medical professionals, other critical COVID-19 response personnel as determined by a state agency head or as certified by an FRS employer that the employee is providing services directly related to essential governmental functions. And what this basically does is it waives the requirements of law that an employee be retired from all FRS employers for at least 6 months in order to be considered retired, and also for at least 12 months to be able to receive FRS retirement benefits and a salary from an FRS employer. So that is something that the state has put out. And looking at the time here, I know we had another piece on this agenda about employees working from home. I'm not going to try to address that in the short time that we have, but we'll open it up to questions if we have questions. And I know there's been at least one question.
Thank you, Jim. This is Kelly, and just so you guys know, if you're hearing those beeps, those are just users that are jumping off of the call, so I apologize for those beeps there. But we did receive one question that came in from a participant, and the question is, will districts need to provide closed captioning during virtual board meetings? So I don't know if maybe Terry or Seth want to chime in on that question.
Yeah, I saw, this is Terry, by the way. I saw the question from Brett. And the answer I sent back to my colleagues was that if you're asked for closed captioning, if it's within your power, you probably have to do it. But that's specific. The federal guidelines that I have read are fairly vague and just simply say that you need to get back on here for a moment. It's not letting me on. But anyway, yeah, I'm back on now. The federal government has not adopted formal guidance on what exactly ADA compliance is. There is some guidance. But I don't think the last time I was looking into this, they had not started rulemaking, on what it was. But I think if you're asked, at minimum, you've got to figure out a way to be ADA compliant if somebody has requested it. The cases I had seen evolved that way. Somebody that was disabled actually made a request, to a district to provide, again, ADA compliance, something where they could communicate. And it was kind of a scan, but anyway, early on, the courts were saying, yeah, you got to do something about that. So, whether it's that specific, if somebody came right in and said, I need sign language or I need closed captioning, if it's within your power to do it, I'd say you could, or you would have to.
All right. Thank you, Terry. Seth, Nicole, did you have anything to add to that?
I would also say that Florida Relay Service, which typically gets put in the notice, gives folks that have hearing disability access to public meetings, and also some of the I don't mean venues, but some of the technology. I know YouTube will automatically close caption things, and I think closed captioning is especially important if your virtual meeting is going to be posted on a website, because there's been case law out there concerning specifically local government websites and whether or not they're ADA compliant. And that was from a few years back. So that, yeah, it can be addressed in the notice, and that's another.
Yeah, some of the programs are capable of doing that automatic translation. Sometimes they come across wildly garbled and they're trying to fix it live. But it's something to consider when you're looking at some of these services, whether it provides that service, because it could be something that can automatically be done, and perhaps something to think about more going forward if this becomes more commonplace.
All right. Well, thank you, and thank you, Brent, for submitting that question. I am looking at the chat feature right now, and I don't see any other questions coming through at this time. It is 1:02. I want to make sure that we are, careful with everyone's time. I wanted to let you know that if you do have any questions at any time for any of our presenters, you can send an email to info@llw-law.com, and we will make sure to forward your question to our presenters and get back to you. Chris, do you have any final comments?
No, I just want to thank everyone that participated today, thank our presenters, and want to wish everybody a healthy future and hopefully a quick and safe reopening to Florida's economy. So.